Welcome to the C.O.D.E Collective podcast, where we unlock the voices, stories, and strategies that drive disability justice forward. I'm your host, Monique Stamps. Join us as we uplift the voices of women with disabilities in discussions on healthcare access, aging, fitness, reproductive health and choice, sex, relationships, and more. Let's get it, ladies. We're joined by someone I deeply admire, a good friend of mine of over, 15 years?
15 years at least.
She's a pillar in the community of Charlotte and a fearless advocate for people with disabilities and racial equity. She's the founder and executive director of Project 704, a community-led initiative committed to support and advancement of people with disabilities. So please welcome the incomparable Judith Brown.
Thank you so much. I would say the same things for you, Monique. Thank you.
Thank you.
It's a pleasure to be here.
Thank you for joining us. Today's episode, we're going to be touching on social determinants of health. Before we dive into what they are, Judy, if you could tell us a bit about Project 704 and the work that you do in the community.
Sure. Project 704 came out actually my life experience out of being a person with a disability and also raising two sons with autism. And I always promised them that when they grow up, I was going to create a nonprofit to support families because for the support we didn't get. And so 2018, I filed. 2019, we got our 501c3. And we hit the ground running going into community. And it's kind of funny because most people know what they're going to do for their programming before they go into we didn't. We went in and asked the people, what is it that you need? What is it that you lack? How do you need help in where you're at? And that formed our programs. So we have about 4 programs now, but one of the main programs is we still go deep into community. We're connected to about 20 neighborhoods in Charlotte, and we're connected to the North Mech area. And then also, we still are peer-led where we support people through this journey of navigating the system of care, navigating resources, just being there along with their journey.
Thank you. So let's go ahead and jump into defining what these 5 social determinants of health are. They are non-medical factors that affect health outcomes. So we have economic stability, education access and quality, healthcare access and quality, neighborhood and built environment. I know that's your jam. And then social and community context. I know that's also your jam. So let's go ahead and get started with economic stability.
Sure.
So you have spent years organizing at the intersections of disability and poverty. Can you share how income inequality and employment discrimination continues to shape the lives of disabled people in your community?
Well, first and foremost, if we start with employment, we're still dealing with sub-minimum wage. We're still dealing with people are being, discriminated against. I deal with clients on a regular basis who would rather lie and to get the job than to say that they have a disability in the interview process. So the discrimination runs deep. Also, most people with disabilities, if they're working, they're not working full-time. So they're working part-time or flex time, and so that's going to affect how much money they can actually really bring in. Mm-hmm. The other thing that most people don't even think about is a lot of people with disabilities want to work, but am I going to lose my benefits? Am I going to lose my health care? Am I going to lose all of these things that I might need, a home health aid? And so employment and economic mobility is still tied to whether you have health insurance or not. Mm-hmm. And that's where this social determinant is so important. There's actually called a name for it. It's called the benefits cliff. So when you reach a certain level of income, all of your benefits are going to disappear. And it's like falling off a cliff. And what happens to that person? So people make decisions based on, well, how much health care do I need? Mm-hmm. And let me make sure I'm at least $10 below the limit of Social Security where it might get cut off. And that's not a way to spur economic mobility, generational wealth. That's not a way to make that happen. It's very punitive. Yeah. So people tend to think in those terms and act in those terms. And I personally went through it. I had a fantastic job when I first moved here. And I mean, it was good. It was so good that I said, okay, I'll leave disability behind. And they were like, oh yeah, we hire you. 45 days later, literally, they fired everybody. And here I was with nothing. And that taught me a lesson because it took some time to get back on my benefits.
Mm-hmm.
How do we survive? How do myself and 2 children survive? And so in the end, I made the decision that, I don't know if I'll ever do that again because it's a negative effect on my goals and my dreams. So
it's like forced poverty. It's a trap.
it's a trap.
That's what it feels like.
I will tell people it's a trap.
It's a trap.
They say, oh, you got benefits, you're great. We're all below the poverty line. SSI and SSDI, we are all below the poverty line. So that then affects housing. It affects our food sources. It affects how are we going out in the communities, our social ability in our life. And that's why these social determinants are so important, because it finally says, hey, a person with a disability, this is how it's affecting these other barriers, is why you're not thriving.
Wow. This is good. And we already touched on how government benefits like SSI, SSDI can trap people into poverty. So we'll move forward to education access and quality. So thinking back to your early advocacy days, what did education access look like for disabled students, and how much has changed since that time?
So you're going back nearly 30 years. When I first had my son and was told in kindergarten that I should institutionalize him and that he would not graduate high school. And then you have to understand that we had the ADA by the time he was born, but it was 6 or 7 years later when we had the Olmstead Act, okay, in 1999, which protected my son to live in the community. So his first 6 years, I was always being encouraged to put my son away. Put him away. He's not gonna be able to navigate the world. He's not gonna finish anything in school. Put him away. And we had to fight. Nobody remembers that because we've come so far. But you had to fight. I've literally had the truants officer call on me with my second son. He's not in school. Well, he's in this program. Well, he should be coming back to school. So there was a lot of fight in those early, even the 90s, when my boys were born, to keep your child at home, homeschool them, and to educate them through even the public system. Because it wasn't really, really protected. We had the ADA, but we all know that was, depending on the state you lived in, it was a different response to everything. So I actually remember my oldest son was the first child with autism they had in the high school. They told me that. First child we had and this was in Maryland. And I was like, are you kidding me? In all this time, you've never had a child make it to this level of high school. And that was the fight, was to keep children even in the community. You didn't see them. They were sent to a special school, sent away. And so just having my son in the community, walking to school, taking a bus, was a novelty. It was a new thing. Where we are now, think 30 years ago, what are we even saying about autism? It wasn't even the way we are now, where we have our ABA therapy, and we actually now have a school that's in Concord that has combined education with ABA therapy. I'm going out to tour them in another week or so. I'm so amazed. So you're having a child have after-school programs, computer programs, combined with ABA therapy. What? So we've come so far in what we're able to do when it comes to education. My son going to college was an unheard of thought. Unless it was a special program just to teach them social living skills. My son has his associate's degree. Right. So these are things, we have come so far in 30 years. And this, I must say, even in the Black community. This was unheard of. This was unheard of. So we have come leaps and bounds, and I'm so excited about that.
Awesome. All right, so let's move forward to healthcare access and quality. All right. Here we go. So,
take a deep breath.
So one issue that comes up again and again and again is bias in healthcare. Yeah. What are some of the most harmful ways you've seen ableism show up in medical settings, and what's the path forward? Before we do that,
I'm gonna breathe, but go ahead.
I just had an experience at a doctor's office I've been going to. since I moved to Charlotte in 2004. My primary care doctor retired, and they got a whole new set of staff, nurses. So I go a couple of months ago, and it's a new nurse. She looks at me and she goes, "Gosh, life in a wheelchair must suck for you."
No, she didn't.
So I had to clutch my pearls.
Yes, yes.
You a nurse?
That's the first thing you say.
The first thing, never met me. And of course, I would have just chewed her out, but I had to report her in that situation. I had to stand up for myself in that situation. But that's where we are in 2025. That nurses, trained nurses, would say something like that to a person. But go ahead.
So, and that's not uncommon. That is not uncommon. I, at the intersection of being a woman, a Black woman with a disability, I've coined a phrase for it. I call it medical profiling. You walk through the door, and they get up and down, and they've already decided what you must be afflicted with. They've already decided what tests they are or are not going to run. Mm-hmm. They've already decided how long they're even going to stay with you. And this happens a lot, but you have educated me on a subject about when we don't even have accessible tables and equipment. And so I'm like, wait a minute, I can stand up so I can get in that mammogram, but what happens to somebody who cannot stand on their own 2 feet and uses a chair? What happens to that person?
I can't tell you how much I weigh. My primary care doctor does not have an accessible scale. If I get weighed, I would have to go to the hospital. Mm-hmm. Mm-hmm. If I'm seeing a specialist, my urologist or my neurologist, that would be the only way I could get weighed. I struggled with because I had 2 children after my injury, so I had to be physically picked up to get on the exam table for my prenatal care and things of that nature. So it was intrusive. My dignity was stripped.
Yeah.
There are some doctors, but it's like a needle in a haystack to find
them.
That has, to get a pap smear, I would have to go to the hospital. Again, physical access is still
a huge barrier. Huge barrier. But then you're also dealing with the way our doctors and nurses and dentists, and this is something that I do on a regular. I work with crisis assistants to do their poverty simulations. And I come in there sharing my history as a person who's in poverty because I get benefits, but as a Black woman with a disability, raising 2 sons with disabilities. And how are we able to navigate this healthcare system? And it's very difficult. I have one vision doctor in this city, and I make the joke that you're going to have to take all that stuff with you home when you retire, because I'm not going to another doctor. I've been going to you for 15 years. We tried. Like you did. You tried to go do, and this man gave the worst prescription that was over. He said, well, I'll just give her more and that'll be better. And no, that would have ruined my eyes. And so I had to go back to her to reverse the prescription. And so this kind of stuff happens every day. Mm-hmm. One of the things that Project 704 does, and we can move on, is that we go to those medical appointments with you. If you don't understand what's happening, you don't understand the language, you need it to be repeated, you're scared because you've never had this procedure or whatever it is, and people are just rushing around and not truly caring about the care they give like that. I mean, I wish I would have been in that room. Okay, but you did the right thing. Yeah, you need to report them.
Lost it on that nurse.
Yeah, I'm telling you.
Yeah.
But guess what? Just having sometimes, I joke, my extra set of eyes and ears. Yeah. Okay, in there, they do it. They suddenly act differently. Somebody's watching. Yeah. And that's one of the things that we do, because there's so many people out here. They don't even understand what applications they're filling out. Mm-hmm. It's not a good situation with our medical system. Now, Charlotte used to be number 1. I don't know where we slid down to. But we are really suffering when it comes to just to get in the buildings. Yeah, yeah. They're not all the way they should be. So, you and I, we could talk forever on that subject.
And I also wonder if she would have said that. I think it plays back in my mind all the time. Would she have said that to me if I had somebody with me? Or would she have said that to me if I was a white woman?
Mm-hmm.
Different things like that just keep
Just
playing over and over in my mind.
So we're quick with these crisis poverty simulations. We are talking to doctors and nurses and PT and dentists, and you'd be surprised at the privilege. You'd be surprised how we're able to help them see the whole person.
Mm-hmm.
You know, don't just come in your head in a chart, head in a computer, tablet. Look at that person.
Mm-hmm.
That's a whole human being. So we're trying to do that to bring this back, you know.
Love it.
We could have a whole podcast on that. Because
look at me and listen to me.
Look at me, listen to me. Mm-hmm. And if you don't see me coming for an appointment, okay, I'm dealing with poverty here. I might have transportation issues. Maybe I didn't get to eat that day, so I didn't take my medication that day. So I just decided, no, I'm not coming at all.
Yeah.
You know, these are the things that happen in the real world that we try to explain to these professions or future professions. Yeah, I'm going to get you hooked up with that because I think that's a very good program.
You know I'm down. Let's do it.
I know you're down. I know you're down.
Follow-up question to that. What would it look like if healthcare systems truly centered disability competency and intersectional care?
Can I break it down simple?
Uh-huh.
They would read that application. There's so many times that I have put everything down there, my family history, all the did you have surgery? They don't even look at it. Are you depressed today? And I'm coming in and he didn't even look to see, okay, she did say. I wasn't feeling real good today. Mm-hmm. And so first is, again, center the person. Mm-hmm. If you've got all these questions, look at it. Mm-hmm. Before you walk into the room. I know you rushed because you got 20 patients, but look at it. Yeah. And say, okay, wait a minute. This person says they're not feeling up to par today. Mm-hmm. So that should change the way you approach them. And then my eye doctor is wonderful. When she walks into the room, she puts everything down and she slides up on a little roller chair. Yeah. And she looks at, how are you feeling today? And I absolutely love it. And then she says, well, she'll give me about 5 minutes. Then she'll say, let's get to this stuff. And then afterwards, she's like, all right, update me. We've been doing this for 15 years. I love that. So when you center the person, when you ask them questions about their humanity, not just their medical state, that would make a person want to relax and say, yes, okay, I can trust you with what I'm going through right now. Mm-hmm. Because we still deal with the stigma and the shame and pride. And so we have to help doctors and the whole healthcare system be better at that. Yeah. Don't just see a list of papers, somebody else done typed it into the computer. Slow down. Yeah. Yeah, just slow down.
See, and I have not gone back to. I'm actually looking for a new doctor.
Another doctor. That's what happens.
Because there was no follow up. Monique, how are you feeling? After there's been no communication, and so I've been going there since 2004, and for that to happen and nobody check on me to see if I was okay.
Nope. I'm on the same look. I consider myself a lab rat for my doctor. As long as them labs look good, she's not even trying to talk to me. Like, I need a little bit more than that. Yeah. And where do you go? Yeah. You and I are both searching. That's kind of sad. Yeah. If you think about it. We'll keep each other. If I find something, I'll let you know. Yeah. I'll let you know.
Let's talk a bit about neighborhood and built environment. Mm-hmm. So what does accessible, affordable, and safe housing mean to you?
That's a hard question because we don't have it here. So we don't have it. I've been told there is virtually no affordable and accessible housing in the city of Charlotte. I fight every day when these new buildings are going up and only 10% are set aside to be affordable, and then even maybe 2% are accessible. I just put a client in an accessible, and the only thing that was accessible was the bathroom. He can't put food away in his cabinets. He can't cook because there's nothing accessible in the kitchen. So they only thought about, we got a roll-in shower. That'll be good. That's not enough. People don't live in their bathroom. So, we're not building it. And we're not, what would start it off, and I do have an organization that's getting it right. People look up the Kelsey.org, I think they're in California.
Okay.
They've built the first affordable, accessible, multi-diverse, so there's some market rate, and then there's a whole center for people to come who need support with their disabilities. That one's in California. The next building is going to be in Alabama. I'm over here rooting for them to come to Charlotte and
Yes.
show the way. So look up the Kelsey.org and you can see their building. It's beautiful, brand new building. But what it would like for us would be, all these buildings you're building.
Yeah.
It shouldn't be 2%. You know what I'm saying? It should be that whole 10% is set aside for people with disabilities, because there are people who would love to move in who are stuck.
Yeah.
They cannot move out. I'm also working with a company now, soon to come out, hopefully across Charlotte, called BTEP. They are microtransit.
Oh.
They literally transport you within a mile of your living. So if there's a store, you can get to the store. Just like we're trying to build buildings that are walkability, their transability, I call them, to get where you need to go. Now they don't have an ADA van yet, but they're working on it.
Good.
They sat down with me and said, what do we need to do? I said, you need one van that can take people using wheelchairs. And so we've started in Greer Heights, and the goal is to show that people are isolated and they want to get out in their neighborhood, but either due to mobility issues, there's so many issues. If we had a microtransit program, they could get in the community, because you can't leave transportation out.
Yeah.
So
Not
you
at
need
all.
safety, you need accessibility, you need affordability, you need transportation, and you need these neighborhoods where people are close to their food supply. It's no good if you give me transportation, I'm in a food desert.
Yeah.
Okay, and that's part of these social determinants.
Yes.
What is around them? Can they get out and go to church? Can they get out and go to the park? That's what to me would be a great neighborhood.
Yes.
That I can get out. I can get to my doctor's office. I can do different things. And still have some money in my pocket, right?
That part.
Because the share riding ain't doing it. The share riding, it's not doing it.
Wow. Okay. Now, the last one.
Yeah.
Social and community context. How does ableism, especially when combined with racism or sexism, affect how people with disabilities show up in public life, in civic spaces, and even in movements that claim to be inclusive?
They don't. They do not. So that transportation issue once again. But also, if you say you're having an event, and I know we're 1 million strong, we're big now.
Yeah.
But if I'm having an event and I gotta park 3 blocks away from the event, you didn't do something right. You were not inclusive.
Yeah.
If I get to a building and you say, well, we're having this in a church and the church door doesn't have an automatic thing and you gotta go around the back for the accessible entrance when everybody else is going through the front, how does that make me feel? I remember one time I went to speak before the city council, and they were like, well, you have to wait in this long, dingy hall till we call you. There was no one in that hall. I began to feel kind of anxiety. I was like, wait, there's nobody here.
Yeah.
Nobody came by. Finally, they said, oh yeah, you're ready to go. I was in no mood at that point and no shape to talk to anybody. I had been left in that hallway for about 30 minutes. What? So here we are saying, we want you to be involved. If you're not hybrid, you're doing it wrong. You're doing it wrong. If we're not centering, I just want people to put the word disability on a flyer. Now you can say every other demographic, put it on there. Put the symbol on there.
Yes.
Have a person, I've told this to big groups that I counsel and consult with, have a person who is your designated accessibility person for a large event.
Yeah.
Somebody should be able to reach to somebody and get an answer. Even if you have to say, well, listen, let me call you back. But give them something. And I can tell you one organization, they changed their whole website. They were like, Judy, we didn't realize that we were not being accessible. I said, I couldn't find where to go. They changed their whole website. They changed all their marketing material. That symbol goes on everything. there's a person to call. And they're saying, Judy, we're getting, I said, well, if you build it, they will come.
They will come. Yeah.
If you don't build it. So that's where we lack the mindset. And that's another thing. We also lack the people to speak up.
Mhm.
If you have a problem, please do not just say, oh, well, I'm not going to go.
Give up.
Call them up and say, hey, I couldn't get in here. I had to park 3 blocks away. My husband had to drop me off, and I had to wait for him to come. No, none of that should happen. You should be able to go independently where you want to go and be involved in any type of work, civic, or social activity without barrier. And so if you don't speak up, they think they're fine. Well, we had a great turnout. That's what I hear. We had a great turnout. I couldn't get in. Oh, I'm so sorry. God bless your heart. Next time.
Next time.
Yeah.
No. So speak up.
Speak up.
All right. So with what happened with that organization making their website accessible, I know that gave you some hope. So that will lead into our last question. What gives you hope that these will be?
When I first moved here in 2010, what was out here? Don't laugh. I call it golf tournaments and galas. That's all you had to do.
Yeah.
Golf tournaments and galas. That's the only time you saw some disabled people trot it out. Today, when we have things like Access C.O.D.E, when we have something like this podcast, when we have other organizations and other disability advocates, I hate to say people don't lose their voice. They regain it.
Mm-hmm.
They always had it. But we're now like this generation, and now with your movement to support the young women with disabilities. That's the next generation. I am so excited because I'll end with this. I remember my mother's idea of advocating for me was, she doesn't see very well, she's gonna have to sit near the board, and I'm late for work.
Yeah.
Look how far we have come from just that.
Mm-hmm.
So I have got great hope that even in this turmoil that we're going through, that more voices are coming up. My emails are off the chain now. Accessibility, indivisibility, democracy for disability. And I'm like, wait a minute, I never even heard of all these groups.
Mm-hmm.
So more voices are coming. So I have such hope that as we all join together to support one another, whatever we're doing, that we're going to change the tide. We're going to change the tide. Because there's some people out there, you're one of them, you're not being quiet. No, don't be quiet anymore. Be present, be confident, show up.
Yes.
And make them take notice. So I have great hope.
I love it.
Well, thank you so much, Judith.
You're welcome.
This has been amazing.
It's been a great time.
Yes, it has. We can talk all day, like you said. But well, that's it for the Co-Collective podcast. And until next time.